The following Pharma Essentia podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hey, Josh.
Kate, we always start with you, and I was thinking it might be nice if I started this episode.
No, sure. Go ahead. Should we take it back?
Yeah, you know what? Let's do this. Hey, Kay.
Hey, Josh. You gonna say hi to the listeners? That's sort of the rhythm we've kind of established thus far.
Duh. Hey, listeners.
Welcome back.
Kay, if you don't mind, I'd like to take this one too.
You gonna champion yourself into doing the whole episode?
Welcome back to the PV Pod, Stories from the Marrow.
A podcast about Polycythemia Vera, brought to you... Fine.
Brought to you by Pharma Essentia.
Thanks, Pharma Essentia. Josh, I have to ask.
What?
What was up with that?
Well, Kate, I realized I need to start advocating for myself. If I want to open an episode, I should just ask.
We totally could have talked about that before we started recording.
Better late than never.
At the very least, I'm glad you're taking the theme of today's episode seriously. You want to bring up the subject?
Don't mind if I do. Today, we're talking about self-advocacy.
Really nice, Josh. Do you want to take over the rest of it?
Nah, I kind of just wanted to do the intro. I prefer kind of reacting while you do the hard stuff.
Sure.
So, self-advocacy?
In past episodes, we've talked about advocating for yourself as someone living with PV or someone caring for a loved one with PV. Self-advocacy is super important, and it's been recommended by doctors and patients alike, so I'm really excited to be spending an entire episode getting into it.
Me too. So who are we talking to today?
My name is Susan Brooks, and I am 65 years old, recently retired. I had been in nursing education for most of my career. I've been married to my husband for 34 years, and we have 4 grown children. My hobbies include reading. I love the outdoors, bicycling, on rails for trails, cooking, baking, and nursing orchids back to blooming.
Kay, I gotta say it. Our guests have really cool hobbies.
Agreed. In addition to all of that, Susan is living with PV.
Oh, I see. So today we're getting the patient perspective on self-advocacy.
That's right. Of course, not every patient's experience is the same, but there's always so much to learn from how someone handled their own diagnosis journey.
And they always have such helpful advice for those who are at the beginning of their journey with PV. As we start to get into it, I want to do a little table setting. How does Susan define self-advocacy?
The way I define it is it's patient-fueled power. For me, it's seeking that knowledge in a way that pertains to my unique situation. This becomes personalized medicine, right? You know, I really needed somebody to look at me uniquely and know that I had some challenges that maybe, other patients weren't having. My disease journey is very different from the next person's disease journey. I think also self-advocacy means, understanding, reading the origins and the genetics of the NPN, the inflammatory process, symptom relief, diet, exercise. What does progression look like, and what novel agents out there to treat NPNs are available so that you stay informed. It's also critical as you move along the journey of PV and self-advocacy to ask and have it explained to you in layman terms. Even though I had been in healthcare all of my career, there was a lot of new terminology that we had to overcome and understand, and now it's second nature. But really, from the first meeting on, have them explain that to you in a way that is in layman terms.
Okay, that was really helpful. I can't wait to hear more about how Susan employed this kind of thing throughout her journey with PV.
Exactly. We'll get into Susan's diagnosis story and how she advocates for herself right after this quick break.
So you're learning about PV on the PV Pod, Stories from the Marrow. Now get ready to take the next steps on your PV journey with What's Next PV, an educational site on everything Polycythemia Vera.
Knowing what's next can help inform the decisions you and your doctor make about the future and is important to your health. What's Next PV can help you understand test results, set goals for the management of your PV, and make a plan to advocate for yourself. Check out www.whatsnextpv.com to learn more. And we're back.
Thanks for sticking around.
Let's get into it. Self-advocacy. I think a good place to pick back up would be Susan's initial diagnosis.
I think so too, so let's go to the start of her journey with PV.
My journey began with an annual visit with my primary care provider. And in that annual visit, he was palpating spleen and liver, as they obviously do in your annual exam. I had come with him with 0 complaints, 0 illnesses, was feeling pretty good. My symptoms were very vague, but I didn't even know they were symptoms to address them. So when he finished, he said he had found something that was very serious and I would need to take care of 3 very important areas. And those included a CAT scan, a bone marrow biopsy, and to seek out a hematologist, oncologist. When I heard the word oncologist, that shook me the most out of all of those areas. We were in the midst of the pandemic, so it was just an unusual time as it was. And the word oncologist just really freaked me out.
We've heard of this kind of diagnosis story a few times now. Panicking at the idea of cancer is so understandable, especially at the beginning when you have no idea what it can mean for you.
We've also talked to a few people who received their diagnosis during the pandemic, which created extra barriers and stress in an already confusing and stressful situation. It certainly doesn't make it easier knowing other people had diagnosis experiences like yours, but it might be comforting to know at least you aren't alone.
So Susan heard the word oncologist, and understandably, it freaked her out. So then what?
I kind of laughed, a nervous laugh, and, explained to him that wouldn't be necessary. But I was fine. I was living my life. There was no way we needed to get any of those areas involved. And he was very stern with me, told me that I absolutely had to take care of those tests. So I went on to realize that some of the symptoms I had been having was I couldn't keep up on a family walk on a flat surface at the local park. Looking back at that was pretty significant.
It's interesting to think about the physical symptoms that we might consider normal just because we're used to feeling that way and we don't have anything to compare it to.
It's definitely hard to discern what's normal and what isn't. Some helpful advice we've received on previous episodes is to compare how you feel now versus how you felt 1 month ago, 6 months ago, or a year ago. That can really help establish context for your symptoms. Are you as tired or more tired than you've been in the past?
Right. So did Susan have any other symptoms?
The month prior to me seeing my physician, I'd had a heaviness in my chest on the left side, and Ashley sought out a friend who's a cardiologist. He ran, the appropriate testing and didn't find anything. So I was just living my life and was blaming a lot of things on anemia that I had battled for most of my adult life. So I went on to complete all 3 things that he asked, and I think I was pretty frozen at that time in fear. Even to go in and have a CAT scan done, I had to go in alone. My husband could not accompany me because of the pandemic, so it was just a very, very unusual experience.
Another unfortunate element of seeking a diagnosis during the pandemic. That isolation you feel is heightened.
Other patients we've interviewed on the show have told us it can take a few weeks after getting tested to receive your diagnosis. Did Susan have to wait long?
It took about a month for the diagnosis to come through, so we had to be very, very patient in waiting for all the pieces of the puzzle to be put together. They, sent off some lab work to the Mayo Clinic. And so once we got the diagnosis, I sought out a local hematologist. This hematologist, oncologist, was affiliated with a large academic hospital about 30 miles down the road from us. And so I felt like I was, pretty much seeing the best. He was young. I felt like he would be well informed. While I was waiting, on that final diagnosis, we were being led into knowing what this was looking like. They were trying to rule out any of the chronic and acute leukemias. I dove right into the research.
Whoa, right away. I'm always really impressed by how much research our guests who are living with PV have done already.
Me too. Getting informed has been recommended by our patient guests and our physician guests alike. Information is powerful.
I had privileges to get into some of the academic libraries. I gathered all the latest breaking research on what my diagnosis was, which was Polycythemia Vera. I gathered all of that research and I brought it into my follow-up appointment with the hematologist oncologist. And that was critical to me, that we stop this disease right in its course. But he said he was not going to treat me with any interferons. He would rather put me on a chemotherapeutic pill. And the reason was that he felt like at the age of 61, I was considered high risk. Even though I did not have hypertension, I did not have diabetes, I had no prior vascular, incidences with blood clots. I was a non-smoker. I exercised regularly. So, that came as quite a shock to us. And as we were leaving, he said, "You are more than welcome to seek out a partner of mine, an affiliate of mine at the large university hospital down the road." And that's immediately what we did. We made an appointment. And I think we were seen 2 weeks later. This hematologist oncologist was actually seen as the MPN specialist in the state of Virginia. So I felt like I, really fell in the right hands. We didn't even have to show him our research and our articles, our journal articles and our evidence-based materials. He knew exactly why I was coming. And he said, "Why would I not treat you with interferons? You're healthy. I feel like we could safely move forward with the interferons." And he hugged us, and we were on our way.
Susan found a better fit for her healthcare team, and she was able to pursue a treatment plan that she felt would best suit her.
Susan's story here highlights several ways someone living with PV can practice self-advocacy.
Ooh, could I try to guess them? I'm self-advocating for a little bit of fun here.
Sure, why not?
1, Susan did her own research to arm herself with knowledge so she could advocate for her preferred treatment plan. Whoa, where are those bells coming from?
Hey, you wanted to play the game.
Cool. Okay. 2, Susan presented her preferred treatment plan to her doctor instead of passively waiting and accepting whatever he thought was best for her. And 3, Susan sought a second opinion when her first treatment plan didn't match her goals. Yeah! Wow, Susan is a self-advocating machine.
I agree. Her story really highlights so many ways you can advocate for yourself.
I'm curious about something. To us, it's so clear that Susan is a self-advocate and a strong one, but I was wondering if she always considered herself to be a self-advocate or if it was something she had to learn along her PV journey.
That's a good question. At the beginning of her diagnosis story, Susan mentioned some hesitation in getting tested, as well as some doubt that her symptoms were all that serious. It seems like there was a shift when she really started to advocate for herself.
For the diagnosis, I really wasn't aware how to self-advocate. I knew something wasn't right, and the vague symptoms, of course, I was blaming it on my lifelong anemia. As I said before, I did seek out a cardiologist for the chest discomfort and was cleared. And I, looking back, I knew my spleen was enlarged. I could see it through clothing. I could see it in the mirror. But I obviously was not ready to deal with that and bring it to anybody's attention. I had a decreased appetite. I just wasn't ready to bring that to somebody's attention. So in essence, if I had to self-advocate looking back on that, I tell people all the time, do not miss those annual visits to your primary care physician. They are critical. Life gets busy, and for a 30-minute primary care physician appointment, he picked up on something that wasn't quite right that could have easily been overlooked. So that's my first pearl of advice for self-advocacy.
Pause the episode. I want to draw attention to that.
A pearl of advice for self-advocacy. Make sure to schedule and attend your annual primary care appointments.
And resume the episode.
Once I got to treatment, self-advocacy became very important at this stage. I knew where the large cancer centers were in the United States. I told myself that if I had to take a train, if I had to take a plane to find an informed care team, that I would absolutely do that. So luckily for me, I was able to drive 30 minutes down the road and find a large academic center for that second opinion and up-to-date information and an up-to-date hematologist oncologist.
This is kind of reiterating the self-advocacy that we mentioned earlier, getting a second opinion and staying informed.
If I had to self-advocate, I would certainly go back and ask the staff, how was I going to feel? I would probably go back and review the side effects if there were any.
Ooh, that's good advice too. You can advocate for yourself by asking your healthcare team questions about expectations surrounding treatment and side effects.
And stay close with your primary care physician. They will guide you as far as, if I was experiencing insomnia, they could help me with sleep therapies.
Your healthcare team wants to make you as comfortable as possible, but they can't know how to help you if you don't tell them you need help.
And lastly, to take the recommended vitamins and minerals that the hematologist oncologist recommended. I'm very strict with staying within those parameters and what they recommend.
And if you haven't been recommended any vitamins or minerals, feel free to ask your doctor what might work for you.
So, looking back, I would do things a little differently and self-advocate for myself, in a way that would inform me. But you're very fearful at that stage, and you're very fearful the first several months. Walking through. Nobody told me that I was going to come out the other side and how long that might take and what that might look like. I would certainly ask those questions now because I think they could guide you in a general sense as far as how soon the medication was going to help, how soon you would be feeling a little bit more normal and, work towards that goal of knowing that I was going to be fine in the long run.
Okay, I've got a question. We've heard a lot about how Susan advocated for herself in the past, during her initial diagnosis, and as she established her treatment plan. I'm wondering if she still practices advocacy now, and what does that look like?
Great question, Josh. We asked Susan to give us a few examples of what self-advocacy looks like for her now.
The first example, I recently had to advocate for myself, and that had to do with my anemia. I'd had anemia all of my adult life and was feeling worse, once the PV diagnosis was made. It was limiting my workouts, it was limiting my family time. But after meeting other patients, I was encouraged by their level of physical activity, and I was really puzzled as to why I couldn't attain that level. And I had asked my hematologist oncologist about iron supplements, and they flatly told me that that was not going to be prescribed. So I happened upon a patient conference last fall in New York, and during the Q&A session with MPN researchers, I explained how my quality of life had been so negatively affected with the anemia, and was there any hope for someone like me? They all agreed unanimously that I needed to take a supplemental iron, and as soon as possible. I took that information back to my hematologist oncologist to tell them that I needed to at least try it because I was really, really affected on a day-to-day basis. They said that that would be fine. They were willing to entertain that. They would monitor me closely, and that I would be their very first patient, Polycythemia Vera patient taking iron. So it has been 6 months since I've been on the iron, and my quality of life has improved greatly. I have stable labs, I have a ton more energy, and overall they're very pleased. And so had it not been for meeting other patients or the patient conference I attended, I would have had to live the rest of my life with a real poor quality of life.
So, Susan is still advocating for herself throughout her treatment plan as she gains new information and learns from other people who are living with PV as well.
Exactly. This example also highlights an educational tool: PV patient conferences and the PV community. If Susan hadn't seen other people living with PV leading active lifestyles, she might not have known that that was possible for her or something worth advocating for. This also feels like a great moment to let our listeners know about an upcoming event.
Ooh, another PV in focus, perhaps? I got an opportunity to go listen to the last one, and it was awesome.
You're right. There will be another PV in Focus event in Dallas on September 13th. You can register at pvinfocus.com.
I love it. Let's get back to Susan. Did she have any other examples of self-advocacy in her own life today?
The second example I could use is that PV, we know, is an inflammatory-driven process. I also learned at this patient conference that the importance of the anti-inflammatory properties of higher dose statins was very important. I was on a statin, guided by my cardiologist, but I was unaware that higher doses would really fight that inflammatory process. So through the patient conference, I was able to find out that there is a specialty called cardio-oncology, and that there are practitioners throughout the U.S. It's a new field. And so I went to the cardio-oncologist. She was very aware of the anti-inflammatory properties. And we are currently working on increasing my dose and being monitored. So those two areas were, very specific to me and very helpful.
Another shout out for the PV Patient Conference. Sounds like those are really worthwhile to attend.
Building a community is so important in both education and mental or emotional support. And attending events for patients is a great way to build community and to hear up-to-date information on PV, since we know the landscape is changing all the time.
Research support.
Exactly.
So we know that new information releases lightning fast. I've learned that each year. And each conference I go to, I get more and more new information. The advances made in cancer therapies were always on the cusp of new information. So attend those patient conferences, join the webinars, join the social media groups, such as the PV-related Facebook groups. Look into the drug manufacturers' websites. There's a wealth of information of patient resources. So many newly diagnosed patients focus primarily on the administration of the drug, and they lose a lot of time just due to the fear. There's a wealth of information on the websites and the social media groups. And, I find that in the social media groups, other patients are so supportive that, you could reach out to them personally if the offer is made and learn a lot about their journey that has probably gone before your journey and could help allay some of your fears. I would tell patients to, seek out patient assistance programs to help with out-of-pocket costs of their medication. And I would also advise them set up accounts with organizations that relate to blood cancers. There are several organizations out there, Leukemia Lymphoma Society, Cancer Research and Treatment Organization, Rare Diseases. They hold resources that you otherwise would not come across.
Wow, there's so much good advice in there. I think I'm going to advocate for starting to end this episode here on such a high note.
Couldn't have said it better myself. Susan, thank you so much for joining us on the podcast today. Your insight on self-advocacy throughout the PV journey has been invaluable.
And thank you, listeners, for hearing Susan's awesome advice.
This has been the PV Pod, Stories from the Marrow,
a podcast about Polycythemia Vera.
We'll see you next time. The PV Pod, Stories from the Marrow is produced by Believe Limited and Bloodstream Media and made possible thanks to our sponsor, Pharma Essentia. The PV Pod is hosted by me, Kay Vermeil, and my co-host, Josh Bragg. If you like the show, please share it with anyone for whom it might make a difference, and leave us a rating on Apple Podcasts or Spotify. We'll see you next time.